I'm right now working as a research associate at University of Liverpool and also an incoming PhD scholar, Monash University, Melbourne, Australia. I am working as the executive member of Public Health Foundation of Bangladesh, and on behalf of PHABD, I welcome you all to parallel session on mental health at 8th Public Health Foundation Day International Conference, which we are this year organizing in a virtual way. We are very, very honored to have Professor Dr. Junu Shamsunnahar ma'am with us. She is a professor of psychiatry at BSMMU, Bangabandhu Sheikh Mujib Medical University, and a role model for all of us. Today, we are going to organize a session on mental health, and I'm particularly very, very interested and overwhelmed because when we started deciding that the conference is going to be organized this year, in spite of having the terrible pandemic, it was very difficult to organize in a very short period of time. But we received a huge number of abstracts. And this session, particularly in mental health, we received highest number of abstracts. So we had a really tough time. I really struggled to find out the best of the best abstracts among the wonderful work done by mostly our young researchers. And I'm very excited because being a mental health researchers, it's always great to see our researchers are focusing on mental health. I want to welcome all presenters, participants, and audience to 8th Public Health Foundation Day on behalf of PHABD, and I want to welcome Professor Dr. Junu Shamsunnahar ma'am, over to you.
Thank you, Tasdik. I'm thankful to Public Health Foundation Bangladesh for inviting me in such a seminar. I'm really excited that the young researchers, they worked on mental health issues. And along with Corona pandemic, we are talking about mental health pandemic as well. So it is really, I think that so much stress is there regarding our lockdown, regarding disease itself, and regarding healthcare issues, and financial issues and whatnot. So and I know that our mental health problems are we have to look into these issues now. So I'm really excited to listen to the young researchers now. So let's start, I think.
Thank you very much, ma'am. Today, Professor Bidhan Ranjan Roy Poddar, who is a director and professor of psychiatry at National Mental Health Institute, Bangladesh, was supposed to co-chair with Professor Junu Shamsunnahar ma'am, but for an unavoidable reason, he has to walk out. But ma'am is with us, so I think it's going to be an excellent evaluation for all of you we are going to present today. The first presentation is on impact of COVID-19 pandemic on mental health of adult population. And I want to invite Mohammad Hassan Al-Banna, who is a student at Patuakhali University of Science and Technology, Bangladesh. Banna, it's up to you now.
Thank you, Deep Bhai, for thank you, Deep Bhai, and Chairman for accepting our abstract and giving me the opportunity to present the presentation. Now I am starting my presentation. Oh, video start করতে হবে। Start video live গেছে তো। Title: The impact of the COVID-19 pandemic on the mental health of the adult population in Bangladesh, a nationwide cross-sectional survey. Background and rationale. The recent pandemic has imposed threat on both physical and mental health problems since its outbreak. the unpredictable nature of this situation and uncertainty regarding COVID-19 pandemic can often trigger psychological distress and mental illness, including depressive symptoms, anxiety symptoms, traumatic stress. High population density, poor personal hygiene practices, and poor economic conditions make vulnerable to Bangladeshi people. There was no information yet on mental health association with or during COVID-19 pandemic in general population of Bangladesh. That's why this study estimated the prevalence of depressive and anxiety symptoms and their associated risk factors during this pandemic situation among adults in Bangladesh. Methodology. We designed an online-based cross-sectional study as COVID bound people to lockdown and home confinement. Duration since April 29 to May 7. Each division participant and the covering of the whole country. Each division constituted 10 to 60% of entire sample except Sylhet division. We able to collect sample 6.3% in the Sylhet division. Procedure: the survey questionnaire was first written in English and then translated into local language. At the time of questionnaire development, we follow the WHO materials on COVID-19 related mental health guideline. Survey question. The survey question comprised 27 close-ended questions, and we use depression, anxiety, and stress scale 21 to estimate the mental health disorder. And finally, we done some statistical analysis such as descriptive analysis, chi-square test, and multivariate logistic regression models. In result section, we found that 28% suffered from mild level of stress, and 22% suffered from moderate, and 9% suffered from severe level of stress condition. In case of anxiety, our study found that 12 to 6%, 12% suffered from moderate level of anxiety, and 6% suffered from severe level of anxiety. And on the other hand, in case of depression, we found that 15% adult showed depressive symptoms, and 9% adult showed severe depressive symptoms. Our study also determined the effect of socio-demographic variables on mental health. Here we found that age less than 23 to 29 showed more depressive symptoms, anxiety symptoms. Male showed less stress than female. Not only stress, but also a male showed more less stress than female, anxiety and depressive symptoms also. Similarly, we found that a respondent from income class of less than 20,000 showed a more level, a higher stress level and anxiety level also. People from rural area showed less anxiety symptoms than urban area. And finally, the conclusion and recommendation. This study observed a high prevalence of mental health symptoms in the general population of Bangladesh. Some sociodemographic factors and perception on COVID-19 are found to be associated with mental health condition. Those findings warrant that consideration of easily accessible low intensity mental health intervention during and beyond this pandemic. Thank you so much.
Sorry, I had a network failure for 1 minute. So perfect. Thank you very much, Bana. It was indeed a very, very interesting presentation. And I must say, conducting a research at this stage, like being a student and from a peripheral university, is indeed, a point of appreciation from all of us. So I must want to congratulate you for that. And during COVID-19, Mahiratul, it's your turn now.
Hello, Bhaiya. Thank you so much. Hello, everyone. Hello. আমার এটা কি ইয়া করে যাচ্ছে, শোনা যাচ্ছে ভাইয়া? স্ক্রিন দেখা যাচ্ছে? আমি শুনতে পাচ্ছি না কিছু।
Yes, Mahiratul, we can. Yes, we can hear you. It can be seen. You can start now.
Now, as you can see, the title of my research is Triple Burden and Mental Health Crisis: a study on the middle class working mothers in Dhaka City during COVID-19. So now I'm going to share with you. The background of the study. It is a well-known fact that women as a class are poorer than men because women are time and resource constrained by the triple burdens of employment, reproduction, and community management. COVID-19 actually exposed and intensified the triple burden endured by women. According to a study by DAGM, it has been found out that 81% of working mothers in Dhaka city reported having anxiety and stress due to work-life community balance aggravated by COVID-19. Unfortunately, mental health issues of working mothers is totally absent in National Women Development Policy, which were formulated by Bangladesh government. At the same time, many research focused on COVID-19's impact on children's health, women and their families' socioeconomic condition, food security, and intimate partner violence. But working mothers' mental health issues arising from COVID-19's onset have regrettably not received the attention they deserve in Bangladesh. So against this backdrop, the study aims to explore how the mental health of working mothers in Dhaka City has been affected due to the triple burden caused by COVID-19. There are two specific objectives of this study. The first objective is to find out the triple burdens working mothers face due to COVID-19, and the second objective is to understand how these burdens affected the mental health of working mothers during COVID-19. So the study is qualitative in nature, and in-depth interviews and focused discussion were the main data collection methods. At the same time, several articles and literatures related to the research problem have been reviewed. At a total of 20 middle-class working mothers were interviewed, and 3 FGDs had been conducted. And based on the availability of respondents, Dhaka City has been chosen as the study location. And participants are requested to identify their class, and they have been classified accordingly. Snowball sampling approach has been adopted to maximize the richness of data, and there are many ethical consideration, which includes informed consent, anonymity, safety and welfare of the participants, which are followed during the study. So now I'm going to share with you the key findings of the study. So at first I'll start from identifying the triple burdens working mothers face due to COVID-19. So I actually try to use Moses gender analysis framework to analyze the triple burdens. So among the triple burdens of gender analysis framework, the first one is productive work. The productive work is mainly associated with paid labor, as the study is mainly focused on the middle class working mothers. Most of them are working, and at the same time they are responsible for taking care of their child and doing their household work. And we all know that at this time there are no childcare facilities and domestic help. And absence of childcare facilities and increasing load of the domestic work actually exacerbate the burden of childbearing, rearing, and caring. And a few pregnant working mothers also reported that they are unable to visit doctor and do some physical checkup, but they couldn't do so, and it deeply affected their mental health. And apart from doing the paid labor and reproductive work, the working mothers are also responsible for regularly communicating with their relatives and community people. They are also responsible for cooking their ill members or ill neighbors, which is often they are having stress and anxiety, depression, and thoughts of suicide. And they are also thinking of scaling back their career ambition and leaving the workforce entirely. There are also some behavioral changes, for example, rudeness, irritation, shouting with children, insomnia, getting annoyed at little things. And at extreme cases, there a few of them also thought of committing suicide, and which ultimately affect their job performance and relationship with children and spouse. So now there are a few recommendations from the study. The first recommendation is that we have to recognize that COVID-19 crisis is a multidimensional crisis, and effective response should address the multidimensional nature of the crisis. And at the same time, we have to make sure that we have disaggregated information, including time use data, And we have other options available to address mental health crisis. For example, it can be protecting existing shelter capacity or expanding capacity to house women if they need to leave their homes, and also a helpline, a national helpline number if they want to get free counseling services. This study has a few limitations. To address this limitation, further research involving that together with a focus on recommendation for government and civil society groups, this could help to inform recommendation for a robust and meaningful feminist policy response to COVID-19. So thanks all for listening.
Thank you very much, Janatapu. Definitely double, I don't know if it is double or triple burden, but it is true that women, men, children, all are suffering mentally in this COVID pandemic. Thank you very much for such an important presentation. I want to invite Satyajit Kundu, a student of Department of Biochemistry and Food Analysis, Patuakhali University of Science and Technology, Bangladesh, to talk on impact of chronic disease on stress, anxiety, and depressive symptoms during COVID-19 pandemic in Bangladesh. Satyajit, over to you.
Thank you, Bhai. Can you hear me? Okay, I'm sharing. All of you guys can see the PPT I shared. Okay, thank you. Can you hear me clearly? Hello. Entitled The Impact of Chronic Disease on Stress, Anxiety, and Depressive Symptoms During the COVID-19 Pandemic, a matched case control study in Bangladesh. The background and rationale of the study. Actually, the COVID-19 pandemic, which is now an outbreak, has induced public and global mental health crisis, as well as a huge psychological experiment. Individuals with certain pre-existing chronic health conditions have been identified as a high-risk group for fatalities of this COVID-19 pandemic, particularly older individuals, especially the older individuals and those with chronic diseases such as diabetes, cardiovascular diseases, hypertension, asthma, stroke, seem to be the most vulnerable. Therefore, it is likely that individuals with chronic diseases may worry during this pandemic to the detriment of their mental health. The aim and objectives of the current study. This study aimed to estimate the prevalence of mental health distresses, for example, stresses, anxiety, and depression symptoms among those with and without chronic diseases during the COVID-19 pandemic in Bangladesh. As I mentioned that this is a matched case control study, so collected data from the participants with the chronic diseases and the individuals without chronic diseases. I'm going to the next slide, methods. The main study design of our article of our study was web-based cross-sectional study. We created a link to collect preliminary. We collected data from 1,427 respondents, and after that 395 of the participants reported currently suffering from at least one chronic disease. Several have the different different individuals have more than one chronic disease. It may also, from the survey list, such as asthma, diabetes, cardiovascular diseases, those are selected as the case groups, and the control groups was selected as the matched for age within 5 years above or below, sex and area of residence to control for possible confounders, as it should be matched with the cases group. That's why we recruited in the final analysis about almost 395 control groups. The main procedure of this study, the survey questionnaire was first written in English and this translated in Bangla by an expert, although the Bangla version of DSS-21 is available. The survey questions, the questionnaire comprises about 29 close-ended queries. The questionnaire had 3 sections: health, which was assessed by the 21 items. Using the DSS-21 scale. There are DSS-21 including 21 self-reported items, distributing among 3 factors designed to assess the negative emotional symptoms of depression, anxiety, stress experienced over the last 7 days. The data was collected for about last 7 days. In the method sections, the statistical analysis were included: chi-square test, Fisher's exact test. Actually, we conducted the Fisher's exact test. The Fisher's exact test was employed especially when the data were not normally distributed. Results. You can see that the first table of the result section of this article is about we categorize two for the age. We categorized into 2 groups. About 60.8% of the participants of above 37 years for cases, and the controls 38.5%. The male and the female in the case are almost 50% are cases and 50% are controlled. You can see the statistical value, the age groups and the and controls, cases and controls. A distribution of DSS-21 scores by cases and controls. Here you can see that the mean and standard deviations value, the mean value of the DSS depression, first the stress, then anxiety, and depression. For stresses, the for cases and control, there is a significant differences. The mean value, significant differences mean value for stresses. Similarly, the anxiety score are significantly different between the 5 subcategory, 5 subdomain to normal, mild stress, moderate stress, severe stress, and extremely severe stress. Similarly, the anxiety symptoms and the depression symptoms are also categorized, and the different percentages are also significant between cases and controls. The conditional logistic regression analysis for socio-demographic and chronic diseases factors associated with mental health outcomes, our final table. Here you can see the reference variable is the age above 37 years. The participants' age was a confounders, but there is no significant value found for the age, stress, anxiety, and depressions. For educational qualification, the participants who had higher secondary and undergraduate degree at least, compared to the masters and above, were less stress. This is an interesting result, I think. But in case for anxiety, the secondary and higher secondary who had secondary and higher secondary degree have more stress, more anxious than the participants with who had masters or above degree. For family income, there was no significant change or family income was not a risk factor for this study. In case of chronic disease, our patients, the patients with chronic disease are 4.28 times more anxious, but have anxiety symptoms than the participants, but than the individuals who had no chronic disease, and 5.5 times more depressive symptoms. They had 5.5 times more depressive symptoms than the chronic disease, than the participants who had no chronic diseases. And here you can see also we conducted the statistical analysis for specific diseases, asthma, diabetes, cardiovascular symptoms, and more than on diseases. The participants, especially, you can focus especially that who had more than one chronic diseases. They were anxiousful who had more than one diseases, and 9.61 times more depressive symptoms. They had 9.61 times more depressive symptoms who had no chronic diseases. And the participants who had the chronic diseases compared to the no disease, are more statistically highly significant. Conclusion and recommendation. This study provides baseline information, I think, because during the COVID-19 pandemic, there was no study, especially among the participants who had chronic diseases, and the article who aimed to estimate or identify the mental health conditions who had chronic diseases. Thus, the study provides baseline information. Individuals with cardiovascular disease are most vulnerable. This study actually says like that individuals with cardiovascular disease are mostly vulnerable to anxiety and depression symptoms during this pandemic time. Those with more than one chronic disease, the last slide, you could see that those with more than one chronic disease are most vulnerable to symptoms of stress. They are most stressful who had more than one chronic diseases. Mental health of we can recommend that following the results, we can recommend the mental health of chronically ill patients should be focused immediately by reaching out via several methods like telemedicine session, which is a rapid intervention, I think. Besides, public health policymakers should incorporate mental health outreach into growing COVID-19 protocols, especially to high-risk population that have existing chronic disease. Because the study estimated that the participants with chronic diseases had highly susceptible for mental distresses. Thank you. Do you have any questions or queries? You may ask.
Thank you so much, Shotajit. The question answer will be later on. Thank you so much. We have observed like comorbidities were, directly connected to COVID infection and COVID mortality. So it's interesting to see that mental health is also connected to comorbidities and, diseases like hypertension and pulmonary disorders. So thank you so much, Shotajit, for bringing this up to the table. Now I want to invite Sadia Sultana Suhi, undergraduate student of Department of Public Health and Informatics, Jahangarnagar University, and she's going to talk on PTSS symptoms and depressive symptoms among Bangladeshi students during COVID-19. If you all can come.
Assalamu alaikum. Good day, everyone. At first, I want to thank Public Health Foundation for providing such a good and very great platform to present millions of lives with many confirmed cases. It's well known that stressful events can take a toll on mental well-being and can result in conditions such as post-traumatic stress disorder and depression. The social and economic crisis caused by COVID-19 becomes so overwhelming. Students has been reported in Greece during the COVID-19 pandemic. Stress, anxiety, loneliness, and depressive symptoms of university students in Switzerland got worse during COVID-19 outbreak in comparison to pre-COVID-19 period. And a study in Italy provided the evidence that confinement due to COVID-19 outbreak can impact on students rather than other classes of people in the population. Here I present the rationale of our study. As for Bangladesh, we all know that students are the first group of people to fall under any intervention against COVID-19, then office workers and others. On-campus activities were called off since 18 March 2020. That was followed by strict lockdown since 26 March 2020 to contain the viral spread. Almost all of the studies were conducted in Western countries, and there is a gap in evidence during the COVID-19 among students. The present study will add to the existing limited evidence and support researchers in designing and implementing effective psychological intervention to deal with mental health difficulties for students when confined at home. Our aim and objective include to explore post-traumatic stress symptoms and depressive symptoms and their associated factors among college and university students in Bangladesh during the COVID-19 outbreak. You can see the method section here. Our study was a totally cross-sectional study through online survey. Being a college and university students, staying in home at least 7 days and had been residing in Bangladesh 8 districts in Bangladesh. Our procedure include a voluntary survey, which was completed by college and university students from 29 May to 22 July 2020. An online questionnaire was developed and disseminated by trained research assistants for data collection through social media. For example, Facebook. All research assistants are trained by experts according to the study objective. An information sheet describing the aim and process right to refuse their participation from the study was presented on the first page of the survey, along with an electronic consent form with it. A total of 4011 respondents participated in the survey, and 3, 9, and 7 respondents are taken for final analysis after discarding incomplete submission. Here is our major section, which includes a questionnaire. A questionnaire had sections and no option. The students are also asked if they perceived the symptom as they had COVID-19 infection. Homestaying activities checklist had options such as online social networking, recreational activity like watching entertainment shows, playing online, offline games, etc. Physical exercise, educational activity, and a scope to mention any other activity apart from the ones mentioned above. COVID-19 related social stressor checklist had options such as prolonged homestay, financial uncertainty, disease uncertainty, inadequate food supply, fear of infection, fear of death by COVID-19, and excessive exposure to the news of outbreak and death on media. Additionally, students are also asked to rate how much their study was disrupted in this situation, from slight to severe. For statistical analysis, we did both bivariate and multivariate logistic regression to predict the odds of potential risk factor associated with PTSS and depressive symptoms. The estimates of the strength of association were demonstrated by odds ratio, both adjusted odds ratio and odds ratio with 95% confidence interval. If p-value less than or equal 0.05 was considered as significant. The Stata version 14.1 was used to carry out all statistical analysis. Here comes our key result section. You can see that a significant percentage of our students are suffering from depressive symptoms. And most seriously, 9.21% are suffering from severe depressive symptom. That is very serious. And the post-traumatic stress symptom, you can see the 59.09% students are suffering from post-traumatic stress symptoms. Here I try to present some our risk factors. You can see the female respondents were 48% more likely to experience depressive symptoms and 38% more likely to have PTSS symptom. Respondents will be affected by depressive symptoms and PTSS. Our fifth key result is it is seen that respondents engaged in recreational activities were 21% less likely to experience depressive symptom and 13% less likely to experience PTSS. So we can see that recreational activities act as a very good preventative factor here for depression, and PTSS. Similarly, respondents engaged in physical exercises had lower likelihood of being affected by depressive symptom and PTSS. Our second key results showed that respondents, those who are in homestay for more than 3 months, are also more likely to experience depressive symptom and PTSS. Here, fear of COVID-19 infection and fear of death by COVID-19 were significantly associated with both depressive symptoms and PTSS with higher odds. Lastly, educational loss from moderate to severe level was also significantly associated with higher odds of depressive symptom and PTSS. Here, this is the last section of my presentation, conclusion and recommendation. The result of this study provide the first nationwide data about PTSS and depressive symptom among Bangladeshi students during this pandemic, suggesting the need for adequate psychological supports. We all saw that the risk factor that predicted higher impact were being female, having suspected COVID-19 symptom, fear of infection, and death by COVID-19, longer duration of homestay, and educational disruption. While physical exercise and recreational activities emerged as the protective factor against depressive symptoms and PTSS. A key public health implication is that the finding of this research could help identify students who are particularly vulnerable to mental health issues so that health authorities can provide effective psychological support around the world to cope with this situation mentally at such difficult time. We hope.
I want to welcome Abid Hassan Khan, who is also a student of Department of Public Health and Informatics, Jahangirnagar University, Bangladesh, and he's going to talk on fear and anxiety among students after 2 months of COVID-19 outbreak. Abid Hassan Khan.
Assalamu alaikum. Thank you, Tasdik Bhaiya, and obviously Public Health Foundation Bangladesh for giving me the honor to present my article in presence of Shamsunar ma'am and other intellectual people in the room. We're all aware that COVID-19 originated from China at the end of 2019, and it was recognized in Bangladesh for the first time on early March of 2020. Many months have passed by, yet morbidity and mortality keeps rising every day. We see loss of lives, loss of health, and statistical curves related to COVID-19, but we somehow overlook the psychological consequences that are being caused in this pandemic. It prevails in all age or social groups, however we say it, but our study is basically focused on student population in our Bangladesh, and our population and our study title is Fear and Anxiety Among Students After 2 Months of COVID-19 Outbreak in Bangladesh that affected over 80% of world student population. And another study from Chinese students, we can say that after the lockdown was implemented, our students are bound to stay at home, and this is an evidence that on Chinese population that the complex influence of confinement policy over fear, depression, and other psychological consequences are prevalent in Chinese students. And if we look at Switzerland, we can see that stress, anxiety, loneliness, and depressive symptoms have, have risen from the pre-COVID period. And from the Greece, we can see which is one of the most successful countries to combat COVID-19, however, has faced a horizontal increase in anxiety and depression and suicidal thoughts. Another study conducted in Spanish University showed that about half of the respondents in their study impacted by outbreak from moderate to severe level of they were impacted by the pandemic psychologically. Furthermore, Italy provided the evidence that lockdown or confinement could have greater impact on students rather than other classes of people in the population. Uh, uh, at the very early stage of COVID-19, which is around April or something. And that study provides us the evidence that anxiety, depression, and stress, such psychological problems are present in our students. With a lot of work going on COVID-19 and mental health all over the world, mostly on general population, we feel the need to break down more into the population and focus on student groups. We decided focus on student groups to assess the psychological phenomenon, anxiety and fear of COVID-19 to be specific. They are going through the psychological phenomenon they're experiencing, and we'll try to assist students who are being home confined during the moment and also have to be residing in Bangladesh during the outbreak. And the procedure, this was a voluntary survey from 29 May 2020 to 22nd of July. The online question was disseminated by the research assistant for data collection via social media. After going through the aims and purpose of study, the responses provided their informed consent prior to starting the survey and completed a self-reporting questionnaire. We have gathered almost 4,011 responses, and however, we have to discard some of the data for being incomplete. We have collected information regarding their social demographic information and the self-reported physical symptoms they are experiencing in this moment, activities during the lockdown, COVID-19 related social stressors that are perceived as psychologically discomfortable. We have used two scales, fear of COVID-19 and anxiety, that is known as general anxiety and disorder 7. For statistical analysis, we have performed descriptive analysis to obtain the characteristics of the participants, and we have run some linear regression to identify the potential risk factors associated with anxiety and fear of COVID-19. The estimates of the strengths of associations were demonstrated by we can see that from our study, we can clearly say that female students have more, the scores for their fear of COVID and anxiety, they were higher in female students compared to males. And it was also seen that university students had higher score in fear of COVID-19 than college students. Furthermore, the students perceiving their physical symptoms as COVID-19 had higher, the students, those are experiencing physical symptoms in this moment, they seem to have higher scores of fear of COVID-19 compared to those who didn't. And this could be the reason that they are perceiving this symptom as COVID-19 without knowing if it's actually COVID-19 or not. Anxiety and students involved in physical exercises had lower scores for both fear of COVID-19 and anxiety. I have highlighted this here because among all the scale scores rising and increasing, we get something that we can actually do at home to combat anxiety and fear that we're talking about. We have conducted a pilot study in April. That is where we got the prevalence of anxiety among students as 33.3%, and we conducted the study after 2 months on a large scale, and this is found that anxiety prevalence has been still rising. behaviors such as physical activity should be encouraged to adopt to increase stress coping capacity among students. Strict implementation of governmental laws and enactment about false news and rumors, misleading information which spreads through social media should be ensured, as we see on that exposure to COVID news is causing us some psychological consequences. Thank you. That's all for me.
Thank you so much, Abid. When a presentation like this comes from a student, we definitely feel proud. We are excellent, excellent, excellent presentation, Abid. And I think this is the moment we all are looking forward to. We should, I think, give a big round of applause to all our presenters today. And we definitely want to hear from Professor Junu Shamsul Ahmed.
Thank you, Tasdeeq. I'm really overwhelmed to see our young researchers doing such research in these pandemic situations. They have so many limitations, but they are doing wonderful job. The first one, that DAS 21 scale, that is validated and culturally adapted in our country by a psychiatrist, and we are very, very familiar with this tool, and I know that it's difficult to score this DAS 21 scale. This is a bit different from other scales to score. They have learned it also. I thank Banna for this wonderful presentation. And the second presentation is by Mahiratul Jannat, and she also did a very wonderful job. I have to admit that she did, qualitative study on middle class working mothers. And you know that I have made quite a few researches with under pressure in our country, and you know that they have workload, they are doing multitasking, and so the recommendation what Mahiratul Jannah said, that they need a free counseling service. We know that the police and the Ministry of Children and Women Affairs, they have hotline, but I do not know that whether they do counseling services. But your recommendation is really, I think, this we have to take into consideration. And the third one, that Satyajit Kundu, I think this is a very great study. I think this is the goes with the first study, but they have separated the more than three has very well developed liaison psychiatry, and we had continuous referral. But I think this needed to be established in other institutions and all over Bangladesh, I think. And the fourth study, the Sadia, and she also gathered a lot respondents, more than 4,000 respondents within a very short period. And I think that, and she conducted a study on students of Bangladesh. And I know that we know that students are having, that they are under lockdown, they are at home, they have educational, they are not doing educational activities now, they are not with their friends now, so they are having the children, young children, adolescents, and young adults, they are under very stressful situations, and the status. And the last one is Abid Hassan Khan. I think this is also among students, and I think that our students needed to be addressed now. Of course, because they are in a very vulnerable condition. Because of their young age, because some of them are in adolescent group, they are growing mentally and physically. So I think I do not know how we can help them, but I think here is also we need to have an counseling support. We are doing, someone has said that about the telemedicine, we are doing telepsychiatry. One of my very close colleague and my senior colleague, Professor Din Mohammed, said that I went to meet him on the other day in neurosciences. He said that, oh, you do not have to touch your patient, so you can do telepsychiatry and whatever else. And so it is, I think, in COVID-19 situation, it is good for us that we can help clients email. And Tasdik, thank you so much for inviting me in such a seminar. Thank you so much.
Thank you very much, ma'am, for inspiring us again. If it was a physical conference, then I could have handed over you a crest or a memento, but now we can not do that. But definitely we can salute you for. Thank you so much, ma'am.
I'll take it from you.
Thank you so much. For it would be my honor if I can hand over you after the pandemic. But of course, thank you for presenting to all the presenters, and thank you, ma'am, for inspiring us again and again. And I think we all of mental health. So I need to check ma'am talks, I think I always am mesmerized and I always want to listen more. I think I can listen for the whole day when ma'am talks. She's so amazing as a speaker and always inspires all of us. Ma'am, this is your first time at Public Health Foundation event, so definitely I think you must be very excited to join us.
I'm also very
I don't want it. Great, thank you so much, ma'am. I think we want to hear from you first, like how you're feeling and how you're perceiving the whole conference.
Okay, as I have joined just a few minutes ago, and I was actually listening to the presentations that were given just in the previous session. And I was amazed to see the young researchers coming forward and doing researches in this pandemic. And yes, my favorite persons are also here. Junwappa is very dear to me. And of course, Dr. Tasdi, you are also, we know each other, and I'm very much fond of your moderating this type of programs. And I would say that I'm really honored to be here today. And I'm eagerly waiting to listen to what the young researchers are to present today. Thank you.
Thank you very much, ma'am. We have presentation today. So the 5 presentations are already been covered by Professor Junu Shamsunahar ma'am, and the next 5 sessions will be chaired by you and Dr. Hilaluddin Ahmed sir. And I think the first session was mostly composed of young undergraduate students. This session is a bit different because we have Sanjida ma'am with us, who's an associate professor at the moment, and also some young presentations will also be there. So it is a very interesting session indeed, because it's not only about COVID-19, it's a combination of COVID-19 and other very relevant topic, like suicidal deaths as well, and also cognitive performances. So I think what we can do, like we can start listening to presentation now, and when Hilal sir will join, I think we can just bring him in. We can continue with the session because we have to complete it by 10:30. Answer to that chat box, and our presenters, they can respond to this question answers instantly in live. And at the same time, if you have any further question, you can ask that during the Q&A session just after when Mazhabin ma'am will talk. So I think without further delaying the session, I want to invite Mr. Rizai Rapi, who is a student at Department of Psychology, University of Dhaka, and he's going to talk on cognitive performance. Rizai Rapi.
Hello, am I audible?
We can hear you clearly, Riza.
Thank you. Hello everyone, this is Mohammad Rizai Rabi from University of Dhaka. My research topic is which type of reward works best for getting better cognitive performance in school-going children. I had conducted that research under the supervision of Mohammad Shuaib Rana, Assistant Professor, Department of Psychology, University of Dhaka. Well, we all know that reward is an appetitive stimulus given to human to alter the behaviors. Reward can be of 2 types, extrinsic reward and intrinsic reward. Extrinsic rewards are tangible in nature like money, gifts, while intrinsic rewards are intangible in nature like verbal praises. Rationale of the study. A famous research was conducted by Hall, R.V. Land, D. and Jackson, which was titled as Effects of Teachers' Attention on Study Behavior. Besides this, there were several studies like Johnson and McClure's and Phelps and Moran found that offering pizza or gifts may motivate few students to improve their academic performance for a short period of time. These studies had shown that reward can have an effect on cognitive performance. The purpose of the research was to identify the best working reward for getting better cognitive performance. The knowledge of the study can be used in educational settings for getting good outcomes. Well, based on the literature review, we have developed three hypotheses of our present experiment. The first one was that extrinsic rewards would cause better cognitive performance than non-rewards. Second one is that intrinsic rewards would cause better cognitive performance than non-reward. And the final and last one was extrinsic rewards would cause better cognitive performance than intrinsic rewards. Methodology. 15 fifth grade students of a school who had an age range of 9 to 11 were selected randomly from the students who had same academic grade in mathematics in the last academic exam of that school. They were divided into three groups, one control group and two experimental groups. Two experimental groups were labeled as experimental group 1 and experimental group 2. Performance measuring sheet was used to measure their cognitive performance, which was developed by the researcher himself along with the supervision of his supervisor, Mohammed sir. In our performance measuring sheet, we used demographics, introductory, and 20 mathematical problems. All of these problems were selected through analyzing fifth graders NCTB provided math book, each of which contains 1 point for each correct response. It was fun to conduct that experiment with the children. A between group design was used to conduct the experiment. Participants were requested to have seat in the room which was assigned by the school authority in order to conduct the experiment. After giving instructions to all of these participants, they came into experimentation room separately and performed their tasks separately. Participants of experimental group 1 received chocolates before starting the experiment. They received more chocolates after solving each 5 consecutive problems. On the other side, participants of the experimental group 2 were highly appreciated by the experimenter for their good academic performance in their last mathematics exam. After solving each 5 consecutive problems, they were praised again and again. There were no time restrictions to solve all the problems in all 3 situations. Each problem carried the equal marks. 1 point was given to participants for answering correctly. SPSS software was used for statistical analysis. Independent sample t-tests and descriptive statistics were used to test all the hypotheses, and alpha level of 0.05 was used for independent sample t-tests. The mean score for group 1 was 17.4, experimental group 2 was 13.4, and control group was 9.6. Comparison between descriptive statistics like means, standard deviations of control group, experimental group 1, I mean chocolate receivers, and experimental group 2, I mean intelligible reward or verbal praise receivers, are going to be discussed in the next slides. Well, from that slide, we see the difference between the mean scores of experimental group 1, I mean chocolate receivers, and the control group, and the significant p-value of 0.001 supported the first hypothesis that extrinsic reward would cause better cognitive performance than non-reward. From that slide, it is evident that the difference between the mean scores of both experimental group 2, I mean verbal praise receivers, and control group, and the significant p-value of 0.005 supported the second hypothesis that intrinsic reward would cause better cognitive performance than non-reward condition. And the final findings, that is very important, the difference, it shows the difference between the mean scores of both experimental group 1, I mean tangible reward or chocolate receivers, and experimental group 2, I mean intrinsic reward or verbal praise receivers, and the significant p-value of 0.007 supported the third and final hypothesis that extrinsic reward would cause better cognitive performance than intrinsic rewards. That slide will tell us about some of the limitations of my experiment. After all this analysis, we can say that extrinsic reward is the best working reward for creating better cognitive performance. There are some limitations of that experiment and some recommendations for those researchers who want to work on that topic in later. I had done that research as my part of honors 4th year final examination. So that's why there was no funding during that period to conduct it with a large number of participants. It will be wise to conduct that kind of experiment with more participants. Even I have a plan to conduct that experiment with many participants after completing my master's program. Secondly, only mathematical problems were given to participants to judge their performance. In future, it will be so much skilled in research. Please pardon me for any kind of lackings in my work.
Thank you very
Thank you.
much, Reza, for such an interesting study on cognitive performance and reward. And we have Professor Dr. Hilaluddin Ahmed Sir with us, sir already joined and listened to the presentation. It was our technical difficulty, so I want to apologize to sir for that. Thank you so much, sir, for joining us today as chair with Professor Dr. Mazhabin Haq, ma'am. And definitely, I think we are very, very excited to have you. Sir, if you want to say something to our presenters and audience, that would be great. Then we can proceed to the next presentation.
Thank you, Mr. Tasdik, and thank you for the presenters. I think the name of the presenter is Mr. Reja. Actually, I just not started the first slide, but I got the methodology and the findings, and it was very exciting research actually at the novel arena of the mental health. Actually, we are not very much acquainted to the research like this, the reward type and the cognitive performance. Always we are research on the prevention, always we research on the prevalence and other study. So the research technique, research arena, and the research topics is a novel topic. And I think whatever the findings, the thought process and think process of the research, the methodology, I just congratulate to the researchers and the presenters. Thank you from my side.
Thank you very much, sir. Sir, we are going to discuss about individual performance and individual presentations after the 5 presentations, but definitely we want to welcome you. And I want to mention to all the presenters that Dr. Hilaluddin Ahmed sir is a very dear friend to Public Health Foundation of Bangladesh. Whenever we need him, he just be there to support us. So I want to invite our second presenter of session 2, Miftahuz Jannat Amrin, student of Department of Statistics, Begum Rokeya University, Rangpur, to talk on predictors of preventive practices and mental health problems associated with COVID-19. Amrin, it's over to you.
Am I audible?
Yes. You are.
Can you see my slide?
Yes, we can.
Thank you. Assalamu alaikum. I am very happy and excited to present my paper entitled with Predictors of Preventive Practices and Mental Health Problems Associated with COVID-19 among Bangladesh University students. I am Miftahuz Jannat Amrin, presenter and author of this paper, and this paper is also authored by Ahmed Hussain Chaudhuri and Mohammad Salim Mondo, and we all are undergraduate students from the Department of Statistics, Begum Rokeya University, Rangpur, Bangladesh. Now I am going to describe the background rationale section. We all know that COVID-19 is a global pandemic, and this pandemic has become a great threat to public health. Here we showed a graph to present the global update on COVID-19 epidemic up to December 4, 2020. And here about the total cases, total deaths, and total recoveries all over the world. On March 8, 2020, the first COVID-19 case in Bangladesh was identified by IEDCR. And now I want to describe that why we wanted to do this study. We know that Bangladesh is a densely populated country, and its university settings have the potential to become contagious disease hotspots due to the close contact among the students. And in this unprecedented situation due to COVID-19, most of the students faced academic and professional career uncertainty, financial insecurity, which impacted their mental health. In these cases, we wanted to investigate the knowledge, attitude, practices level along with mental health problems towards COVID-19. And the purpose of our study to evaluate the knowledge, attitudes, practices level among university students and identify the mental health problems related to COVID-19 and determining the predictors of preventive practice regarding COVID-19 among the university students. Here, I want to show the method section. Firstly, we selected the study area and population. We have done a cross-sectional study from April 15 to May 15, 2020, and we considered 8 public universities from 8 divisions, and the total respondents data are collected online survey using social media such as Facebook, WhatsApp, and here we use mobile sampling. And there also exists some previous study where same sampling technique was used. And to measure the CAP and mental health problems, we wanted here to test the validity of our questionnaire, and we used here the Consensus Alpha to test the internal consistency of our items, and then we observed that all the Consensus Alpha values meet the acceptance level. And there also exists some previous study where used this measurement. And to do statistical analysis, firstly, we considered the variables, and here I want to mention that our dependent variables are knowledge, attitude, practices, and mental health problems. I mentioned previous slide, depression, anxiety. Hypochondriasis, social phobia, and boredom. Predictors, dependent variables, we have 5 or 4, and we used SPSS to analysis. Now I want to present our findings. Here we observed that most of the respondents apprised that fever, dry cough, and breathing difficulties as the sign and symptoms of COVID-19, and 93.5% respondents indicated that touching and shaking hands with an infected person as an active transmission mode. And about 81.1% respondents reported that home quarantine as a prevention of COVID-19. And here we showed positive attitude and good practices towards COVID-19 among the university students. 80.6% respondents showed positive attitude to government should lock down the travel areas to avoid a spread of COVID-19, and more than 90% respondents tried to avoid contact with infected person. And to find out the significant predictors, we use multiple logistic regression. From this forest plot, we have found gender, knowledge of signs and symptoms, and knowledge of transmission as the significant predictors of poor prevention practices, along with their odds ratio. And here we have found the significant predictors of depression, anxiety, and hypochondriasis. For depression, we have found age, knowledge of signs and symptoms, and knowledge of transmission as the significant predictors along with their odds ratio. And for anxiety, we have found same variables, including attitude about COVID-19 as the significant predictors. And then we have also found same significant predictors for hypochondriasis, along with by place of including place of residence, that means birthplace, with their odds ratio here. And then we have found the social phobia and boredom for the significant predictors. Here we have found level of study, knowledge of signs and symptoms, and knowledge of transmission and attitude about COVID-19 for as the significant predictors of social phobia. And for boredom, we have found gender, age, place of residence, that means birthplace, knowledge of signs and symptoms, knowledge of transmission, and attitude about COVID-19 as the significant predictors. Now, here presented our conclusion and recommendation. After this study, we concluded and recommended that there needed integrated awareness and education programs to increase CAP levels, that means knowledge, attitude, practice level regarding COVID-19 among university students in Bangladesh. Mental health problems, the government along with the universities should grant immediately proper psychological support to the university students. This study had some limitations too. Since we collected data via online using social media, So the respondents were not interviewed face to face. That can be a potential limitation of our study. And then some biased questions might be subsisted within the attitudes domain. And finally, this study disclosed that there must be needed more extensive study. That's all about my presentation. Thank you. If you have any questions, feel free to ask me. And if you have any recommendation or suggestion to me regarding the improvement of my research study, you can kindly tell me. And you also can suggest me by me. Thank you.
Thank you very much, Miftahul Jannat. If anyone have any question, they can write into a Q&A segment. You can see over here, and we'll hear from our chairs later on after three more presentations. And I definitely want to echo with Miftahul Jannat. Our students need psychological support from their institutions. There is no way we can ignore them. Thank you so much for such an excellent presentation. Now I want to invite another student. His name is Abir Arnab, Department of Urban and Regional Planning, Rajshahi University of Engineering and Technology, Bangladesh, to talk on human psyche during the prolonged lockdown in COVID-19. I'm excited to see, a student from engineering background is going to present today. Yeah, Arnab.
Assalamu alaikum. Am I audible?
Yes, absolutely.
Yes, thank you. Assalamu alaikum. This is Abir Arnab presenting a paper entitled Mental Health in Lockdown, a study to analyze human psyche due to the prolonged lockdown caused by COVID-19 in the 8th Public Health Foundation Day and Virtual International Conference 2020. You can see here the list of our co-authors. Starting with the abstract, we can say that the Bangladesh is a developing country. People here always have the tendency to overlook the mental health status. Because of the unwanted long-term lockdown, people are facing mental and psychological breakdown. It is as important as physical health, but it is not considered with proper attention. This research tends to uplift these humanitarian failures due to the lockdown and recommending proper solution which will help reducing the impact. To minimize the catastrophe of this COVID-19 lockdown must be ensured. The common lockdown was declared on 22nd March in Bangladesh, which was effective from 26th March to 20th May. Then this pandemic situation caused huge damage on different sectors like national economy, medical sectors, as well as educational sectors, and so on. Bangladesh is surely suffering to cope up with the consequence of side effect of lockdown. The primary data of this study is collected through online questionnaire survey from 120 people of different age scale with 95% confidence level. Our initial statement was to bring a lot of people, which is of more skill, but due to this lockdown, we cannot go outside and have interviews. So we must confine ourselves in online medium. So 1 to 20 people is sublime here. Secondary data is collected through the related research papers and journals. This study finds that 26.5% people feel more insecure as their economic condition is hampering. It is creating a psychologically vulnerable group, as 35% people stated that the isolation has caused so much dilemma in their regular life. Adding to that, 70% people feel that financial loss and creating uncomfortable psychological environment around them, when it eventually leads to violence, as 15% people stated that they are in verge of psychological explosion of violence and anger-related problems. The study recommends that particularly steps as discussed should be followed to avoid unnecessary psychological dilemma. The impact of lockdown on someone's mind is severe. Though it is not the worst fear right now, eventually still these symptoms can be noticed with due attention. The government or the local organization need to find a way to eradicate these psychological problems which will ensure better health condition. With next up, the aims and objective of study, we can define that the study is done due to find out the psychological condition of people during COVID-19 outbreak, to get an idea about the public health situation in Bangladesh, to show the concerns of common people of Bangladesh, to analyze the change in behavior in human mind, which is obviously very much important. The methods of the study depends on the outcome of the study eventually, but Starting up with the methods, we firstly done the questionnaire survey, as I have told earlier in the abstract segment. Then we indicate the false and clarify the certain outcome variables which will be conducted throughout the study. Then we have done some data analysis. For key results, I am going to mention three main results which we will be heading towards: the change in dietary pattern, change in sleeping schedule and duration, change in physical activity. It's often reflect the psychological condition of a person. More regular pattern of consumption indicates more stability in human physics. And inconvenience of this pattern signifies the change in mental state. 24% people said that they lose or can lose control in following dietary pattern because of their mental instability. 43.9% people told that they find sleeping troublesome some of the time in this lockdown period. 22% participants depicted that they had problems in falling asleep most of the time, and just 2.4% faced this problem in almost always. The information from the field survey indicates that the lack of physical activity make people fall in depression and anxiety. Analysis also indicates problem routine to this physical activity sector. With the lack of work and breakage of routine life, the people become bored, and a bored mind is the house of all evil that we all know. In the psychological vulnerability, it is alarming cases. Shockingly, you can see in the graph of left, shockingly 36.6% people feel that the boredom influenced them to do something bad. 12.2% said that they are unsure about that feeling, and tiny things let 56.1% people become very angry on others and themselves also. On the graph on right, the 37% people express that their boredom influenced them to do something that will be bad for them, and 12% are unsure of that. And again with the lack of action in recent times, a matter of pity that 24.4% people think that lack of action in recent times make them violent. On the same note, 34% became frustrated seeing others doing their regular jobs. And with the self-harming activities, 7.3% people stated that this lockdown ever made them doing self-harming activities, and another 7.3 are confused on that. Though the numbers seem to be very low, but the number represents a lot of people. Coming out with the strong point of physical losses, the economic condition goes threatening to some extent for many people. Most of the test samples are earning for their family. 36.6% people earning got hampered because of this lockdown caused by COVID-19 on a scale of 5, in which the scale number increased, the higher damage of the economy. 18.8% are on scale 1, 31.3% are on scale 2, and there are 12.5% people are on level 3. 6.3 and 31.3% people are on scale and on scale 4 and 5 respectively. The questionnaire had a question on does the financial strain make them uncomfortable nowadays. 44.5% agrees with the statement, while the 24.4% people said that they can feel uncomfortable because of this economic loss. Again, with the participants, they are selected level of impact of the financial loss in their life, where the more the level, the greater the loss destroys them. Figures below that show us that people are eventually from each section are impact they are having in financial troubles. At last, we can say that Bangladesh is a developing country. The healthcare sector is recently been boosted up. Many work and initiatives are taken with a view to give stability to human mind with freshness and positivity. The study is also about discussing the present condition of people with respect to psychological condition and behavior in lockdown. We hope that our findings will contribute to the lessons to be learned about the mental correlates and consequences of such a pandemic and radical lockdown. Thanks to the Public Health Foundation and all the listeners. Thank you again. If you have any queries and questions regarding this topic or the presentation, please feel free to ask us.
Thank you very much, Habir Arnob. Since the beginning of COVID-19 outbreak, we're looking for evidences, like if really in a real way mental health is being impacted. And it's great to see, evidence are coming from young researchers like you. And of course, with non-mental health or non-health background, which gives us immense pleasure to see the prospect of multidisciplinary research in future. So thank you so very much. And now it's time to Thank you so much. Now it's time to hear from, I think, one of the much awaited presentation of tonight. I want to invite Dr. Sanjida Akhtar, Associate Professor and Head, Department of Forensic Medicine, Green Life Medical College, Bangladesh, to talk on suicide deaths using chemical substances. Welcome, ma'am.
Thank you. Thank you, Dr. Tasdiq Hassan. Thank you to Public Health Foundation of Bangladesh for giving me the opportunity to present the study.
I'm not sure if it is a network issue. Ma'am, can you hear Sanjida, ma'am? Ma'am, can you hear her? No, okay. It seems like a technical difficulty from Sanjida ma'am's side. Oh, you can hear her. Okay.
No, I can't.
Okay. Yeah. So it seems like a technical problem. Oh, great. Yeah, she's back.
While the link between suicide and mental disorders is well established, many suicides happen impulsively in moments of crisis. Further risk factors include experience of loss, loneliness, discrimination, a relationship breakup, financial problems, chronic pain and illness, violence, abuse, and conflict or other humanitarian emergencies. The strongest risk factor for suicide is a previous suicide attempt. Now I will start my PowerPoint presentation. On a cross-sectional study of suicidal deaths using chemical substances as revealed by autopsy findings from Dhaka Medical College morgue.
Ma'am, do you need my assistance to do that? I have, okay.
Yes, first slide. Poisoning is one of the common methods of suicide in the world. Suicide by poisoning is the act of intentionally killing oneself by using various chemical substances. Suicidal death by using various chemical substances is the most common and widely used in developing countries like Bangladesh. Suicide. Suicide is often an impulsive act resulting from the failure to adjust with their surroundings and cope with the stress they are exposed to. We know that suicide victims generally suffer from a variety of psychiatric disorders such as depression, bipolar illness, schizophrenia, and substance abuse, among others. Here have been recognized lack of attention paid to the significant role of pesticides in contributing to the problem. To reduce poisoning cases, proper emphasis should be given for safe use of pesticides, and consciousness should be created among the population about poisonous compounds. Detailed study regarding death due to poisoning is required to be carried out in this country. Pesticide poisoning is responsible for great number of admissions and deaths in Bangladesh. A major portion of them is due to organophosphorus compounds. Nevertheless, non-organophosphorus compound poisoning is underreported. Creating a register of common pesticides in each region for rapid identification of nature of the pesticide is recommended. Poisoning studies in Bangladesh require more strict criteria for case definition. Undoubtedly, conducting prospective studies by application of sample identification to determine the nature of toxicant will increase accuracy of findings. The objective of this study are, firstly, to assess the suicidal poisoning cases brought to the morgue of forensic medicine department of Dhaka Medical College for autopsy. Secondly, to find out the demography of suicidal poisoning cases, its distribution according to age, sex, occupational status, family history of suicides, causative risk factors, and this study focused upon suicidal death occurred by poisoning of autopsy cases held in the morgue of forensic medicine department of Dhaka Medical College, Dhaka in the years from July 2016 to June 2018. Study population were deceased upon whom autopsy was conducted. Permission for the study was taken from the concerned department from where data were collected. For each and every victim, separate data collection sheet was prepared. Victims are selected purposefully according to the availability in the morgue of Dhaka Medical College. Relevant information was obtained by performed structured questionnaire from the relatives of the victims. Data were collected from the relatives of the victims, from the doctors who performed autopsy at Dhaka Medical College morgue, and also from chemical analysts, victims of suicide using chemical substances as revealed by autopsy findings from the Dhaka Medical College morgue, and chemical analysis report from chemical examiners office Mahakali, Dhaka were enrolled in this study. Victims of suicide not using chemicals were excluded from the study. Half of the victims, about 50%, were aged about 20 or below. Suicidal deaths by poisoning cases, 66% victims were male and 34% were female. From the distribution of the study victims by education level, it was observed that more than 1/3 victims education level belong to secondary education. 26% victims education level belong to primary education. About 20% victims education level belong to higher secondary education, and about 10% victims education level belong to graduation. From the distribution of the study of the victims by occupation, it was observed that more than 1/3 of the victims were students, followed by housewives and day laborers. businessmen, service holders, and others. This chart showing the victims by occupation, majority of the victims were students. In this study, organophosphorus compound was found to be the most common chemical substance in suicidal deaths, which was found in 58% victims, followed by diazepam victims and barbiturates found in victims after receiving chemical analysis report from Chemical Examiner's Office, Mohakali, Dhaka. No chemical substance were found in 30% victims after receiving chemical analysis report. In fact, it can be said that measures to improve the socioeconomic conditions through reasoning, government should provide toxicological diagnostic and therapeutic assistance to doctors. Again, the existing laws in relation to toxic substances should be incorporated to erase the loopholes for their production, distribution, sale, storage, and application. Finally, to reduce the number of suicide by poisoning, national and
I can't hear you, Sanjidata ma'am. Okay, I think it's just the last line of the presentation. So we can thank Sanjidata for such a nice work.
Thank you, Tasdik bhai. Honorable moderator and panelists and dear attendees, my salam, assalamu alaikum. I'm Mohammed Abdullah Al-Jubair Bistas, going to present my study. The name of the study.
Can't hear him. Very low voice.
Yes.
Not audible.
Yes, Jubair, you need to. Yes, you need to speak a bit louder. Yeah. Jubair, can you please talk?
Hello, Tasdik bhai. Can you hear me now?
Yes, we can hear you. Yeah, talk a bit louder. Yeah.
The name of title of my study is Prevalence and Factor Associated with Depressive Symptoms among Medical Students During COVID-19 Pandemic in Bangladesh across sectional wealth severe acute respiratory symptoms coronavirus 2 was identified in city of hello
Yes, yes. This is okay now. So I think you need to speak a bit louder, a bit louder. I think it's a problem with the device.
Okay, now is it okay?
No, the screen is okay. We can see the presentation, but you need to speak a bit louder, or you need to increase the sound of your device. I think there is a volume issue. The easiest option is to talk louder, but a bit louder. Yeah.
Okay. The severe acute respiratory symptoms coronavirus 2 was identified in the city of Wuhan, China, in December 2019. To prevent coronavirus, lockdown is going on in many countries. Like other institutions, school, college, university, medical college has suspended their functions and closed for this period. These preventive measures may have increased stress, psychological pressure on medical students as they are unable to complete their study. They are losing of close relatives and personals. They are in high risk of exposed to COVID-19 virus. The study in India found that the prevalence of depressive symptoms among medical students during pandemic was 74.6%, whereas this prevalence was 50% in Pakistan and 27.6% in India. During the lockdown period in Bangladesh, the prevalence of mild to moderate depressive symptoms among university students was 82.4%. We extensively searched literature but did not found any study among the medical students of Bangladesh to find depressive symptoms in Bangladeshi medical students. The study was a cross-sectional online survey and conducted between 21st April and to 10th May 2020. As this is an this was an online survey, we utilized Google Form web survey platform. So before sending invitation to the respondent, our study team finalized respondent list by using their professional social network with the following inclusion criteria. Our team finalized a list containing a total of 25,050 respondents with detailed contact information. The minimum sample size was calculated and the background, objectives and declaration of confidentiality. The study tool had 8 sections, including depressive depressive symptoms measurement tool. So for measuring depressive symptoms, we use a partial health questionnaire, standard deviation for for assessing bivariate relationship. We use binary logistic regression, and for multivariate analysis, we used stepwise logistic regression with removal algorithm. All data was analyzed by using Strata 15. So here is the result of my study. The total study participant was 425. The average age was 22 22 years. with a standard deviation on 0.8. Most of the respondents are female, unmarried, and monthly income less than 5,000 taka. The prevalence of a mild to moderate level of depressive symptoms was 80.2%, and this prevalence was significantly higher among female medical students compared to the male medical students. The significant high prevalence were observed for the medical student who suggest to get away from social media, had optimistic outlook, always faced sleeping disturbance in the last 4 weeks. And the significant associated factors, we found 3 significant associated factors, including gender, struggling to get away from social media, sleeping disturbing in the last 4 weeks. So finally, higher in conclusions and recommendations, we higher study is needed to determine long-term effect of poor mental health issues. Thank you so much.
Thank you so much, Jubair Bhai, for doing this research on a neglected topic. Mental health of medical students is always been ignored systematically. I don't know why. So thank you so much for that. And it is, I think, this was the last presentation of this part of the session. So I don't want to delay further. We all are looking forward to hear from two of our esteemed chairs. So I'll jump to the first, chair of today's session, Professor Dr. Maza bin Hokbam. We are looking forward to hear your technical and valuable advices to the presenters.
Thank you, Dr. Tasdeeq. First of all, I must appreciate the young and the esteemed researchers word on cognitive performance of school-going children to suicidal things, the toxics, what type of toxics or poisons are used to COVID-19 and all of them. So let me first start from the beginning that Mahmoud Reza Rabbi, yes, it was a wonderful presentation, a very simple, but something to ponder on. And we have seen that in our lots of studies, we have seen the effect of punishment and reward. So there have been lots of punishment regarding this, that how reward works in learning or performance compared to punishment. But this is focused only on punishment and two types of punishment, the tangible things and the social praise. But I'm sure as the number of size of the sample is very small, so the results cannot be predicted. And also this result is applicable for the age range because they have chosen only 9 to 11 years old children. I'm sure if they have the opportunity to take different age level groups, then the results might have been different. I would like to thank him, the young researcher. He's still a student learning, and he told that he would like to work on it in further researches. So that's all from my side, but I would suggest him that he should keep in mind to use different schedules of reinforcement and taking the match group, because the group of students who are divided into two groups, they have to be matched. And another very important thing is to pick something which they are not used to. Like in this experiment, the researchers have used, I think, mathematical problems from class 5 books, so which they are, they are familiar with it. So in researches, it is better to take something, any kind of analytical reasoning things or like this. So the difficulty level would be same for all groups. So these are my few suggestions, but I do congratulate him. The second one was the predictors of preventive practices and mental health problems associated with COVID-19 among university students. And I would congratulate Amreen to do such a, I would say, a huge amount of time and effort has been given on this research, because 8 public university students were taken as samples, and it is not such an easy thing to do, taking 850 the sample size. So here also we've got to know that the rate of depression, anxiety, hypochondriasis, social phobia, boredom, what is happening, and the KP. And she has mentioned it very timely, that the need for helping the students of universities to cope with the COVID situation regarding their mental health. So which is very important to provide them counseling services. And lots of statistical analyses were presented, because she is someone from the statistic department, and the presentation was really colorful. So thank you, Amreen, for your presentation. I'm just touching a little bit of everything, so I don't take much time. And the third one was presented by Abir Orno, and also another researcher was Bipasha Akhtar. So it was to analyze the human psyche due to the prolonged lockdown caused by COVID-19. So here also we see lots of the statistics that the insecurities, more than 50%, I think we saw that 62.5% people are suffering from insecurity. The rate of depression is also high, and the vulnerability due to COVID-19, which if it is, if the duration is more than 2, 3, 4 months, then there is a probability of this population to fall into some kind of mental disorders. So the vulnerability, psychological vulnerability, the people are being very edgy, becoming alert, and the irritability, their aggressiveness has been increased, the loss of financial loss. These are all, everything is having a impact on their mental health. And I would say that it is very common, those who we are practicing. I think Dr. Helal would also agree with me that the students who are coming to us, the people who are coming for mental health services, we have seen that they are having difficulty regarding these 3 points that he mentioned, the dietary pattern, which they are losing appetite, or they are eating more food, taking junk foods, not maintaining a regular diet, and they are having sleep disturbances. So, and also the physical activities has decreased. They are not going outside. They are not doing any kind of exercise. So these all things are actually having a negative impact in the person's life. So this have came out through the research, which confirms our I was actually looking forward to know about it, because this type of researches are not done in our society. You know, it's a very limited number of people actually have the access to do such researches. We do researches on suicidal ideation and lots of things, the causes and the prevalence rate, etc., etc. But I would like to congratulate Dr. Sanjida Akhtar and her team to present such you know, insight research that more than 50% of the victims were less than 20 years old, and 66% of them are male. So it also confirms that females tries, but males actually succeed in suicidal deaths, and most of them are students. So these and the type of poison they are taking. So I totally agree with her that these research findings, if given to the authority, they will have a guideline, a proper guideline to develop. They will develop a proper guideline to have the restrictions on selling and, you know, the amount of poisons to be sold to people. So these are the things that I liked very much from her. And the last one is from Abdullah Zubair and his team, which was done with medical students regarding depressive symptoms and during this COVID-19 pandemic. And in this also, what we are talking about now, that all over the world, now we are facing a terrible consequence, not only because of pandemic, but also because of our the way of lifestyles, the hectic actually gave us a picture what is happening in Bangladesh. So we found that more than 80% of the total population, I mean the medical students, they are suffering from depression from mild to severe level. So this is definitely a very alarming, because we don't want our young generations to be depressed, because they will be serving the country, they will be leading the country, and we want healthy population. So now is at the high time what to do about it, to have the statistics and move forward with it to mitigate what is causing these depressive symptoms and all these things. And this is also a very, I would say, a big sample size, I think of more than 400, I remember. So that is also a very thoughtful and insightful, I would say, research findings. And I would like to congratulate and appreciate all of you for giving me the honor to listen to your presentations and giving me the opportunity to say something about it. Thank you very much. Thank you, Dr. Tastis, for inviting me and enlightening me in through that.
Thank you so much, ma'am. We are actually honored, and every time I hear you, I learn something new. And today, I think the insightful recommendations and critical analysis from you, I think it will be very, very useful to all the presenters, the presenters who were present during your session. Thank you so much, ma'am. Now, I want to hear from. I think everyone is also waiting to hear from Dr. Hilaluddin Ahmed, sir. Sir, I think if you can summarize the session, that would be great.
Thank you, Dr. Tasdiq. I think I am audible, though I am in hospital, so I am wearing the mask and other head shield. It's a great opportunity for me also, like Professor Mejamin Madam. It's a learning session for me also, because the very good sessions, 5 lectures, 5 presentations, 5 researchers, very young researchers. I congratulate them. And I also thank to the Public Health Foundation and Dr. Tasdiq for inviting me in these sessions and give the opportunities a few words regarding the research on the mental health. Actually, what the mental health? It's my passion to say something or see something or learn something from the any session from the mental health. So I congratulate all 5 presenters. They're very brilliantly presented and very, I think, the extraordinary thoughts they are provoking regarding this the research. Actually, 3 researchers are focused on the COVID-19 and mental health. It's very nice. It is obviously the nowadays we are passing the pandemic. I think Mr. Bifta, Mr. Ashir Arnab, and Abdullah Jubair and that team. These three researchers. One is the COVID-19 and mental health issues they are showing by the MIFTA, and Arnab are showing the human psyche in COVID-19. The title is a little bit atypical for me. The what is human psyche actually? We are not using the human psyche in the biological manner, but in the very social norms and the social jargon, the human psyche, and very much related with the some provoking us the philosophical thoughts regarding this COVID-19, not the disease only, right? Where the Mr. Jubair showed that prevalence of depressions and other issues that is the 5 to 6 times more than the general conditions rather than the in this pandemic condition. And I like very much all these 3 articles and research on this. Especially, I congratulate Ashir Arnab about the terminology used, that the human psyche. I congratulate all of them because the COVID-19 is a very emerging issue. Another 2 research by Mr. Reza and Dr. Sanjida. Mr. Reza, I already said about his research, that is the reward mechanisms to the cognitive performance, the suicidal thoughts, talks, and others, what he showed. I think the way he done the research is very unique and very unique. We are not using regularly doing this type of research. So this is the unique research by Mr. Reza. I congratulate him. And last but not the least, Dr. Sanjida, the suicidal thoughts and suicidal issues and by the chemicals and the poisons, what the madam said, I think it's a very time demanding, especially in the pandemic situations also. The suicide rate is high throughout the world. And in Bangladesh, the availability of the chemical substances is a very important issue. And this research also gives us some notion to the policymakers, how we control the chemicals, how we control the over-the-counter drug, how we control the OPC poison, other poisons. This is the very important issues nowadays. In the WHO also said 3 or 2 measure how to we can decrease the potentiality of the insecticide. We can use the safe box for the insecticide. We can prevent the selling of some over-the-counter hypnotics or other drugs by this way. So less of the availability is one way, one mode to decrease the suicidal rate. So all the 5 research, all the 5 presenters are very brilliant and young, energetics, and I must say congratulate to the Public Health Foundation to give the platform to this type of researchers and the young researchers to express their research here. And the another uniqueness is this: when we are talking about the health system and the medical model, we always saw the researchers from the medical field, but here most of the researchers from the non-medical field. It is again, I congratulate to the Public Health Foundation to accommodate all the researchers, all the persons in these mental health issues. The mental health issues is not for the doctors, it is not for the confined within the psychiatrists. It is the public health issue, it is the multi-sectoral issue, it is the issue for educationists, it is issue for the social worker, it is the issue for the researchers and everybody. So thank you to all, and I am not taking too much time, especially Madam Said and critically appraisal all the presenters. I again thank you all. And thank again to give me the opportunity to say a few words in this session. Thank you, Tasdik. Thank you all.
Thank you so much, sir. Thank you so much, ma'am. I think it was one of the best sessions of today. And I definitely want to mention that Public Health Foundation is trying to be more inclusive. We do not want to confine only with clinicians or public health professionals. It should be for all. This is a platform for all who are interested in health. So definitely it's an open invitation to you all to join us. And I definitely want to congratulate all the presenters, all the audiences. We can see some very, very active audiences. I can see Associate Professor Mohammad Siddiqur Rahman sir, Saidur Rahman Mashliki sir, my faculty Pradeep Sen Gupta, they are listening. And it's now 9:53. They are listening and commenting. So it's amazing to see the enthusiasm of such learned audience tonight. And Professor Dr. Mansabin Haq ma'am and Dr. Heraduddin sir, it was our honor to get you as our session chair tonight, and definitely your amazing critical appraisal and appreciating work for our young researchers will boost their enthusiasm for doing multidisciplinary research in future. With this, I want to thank everyone and I want to wish a very good night. And we have another day. Tomorrow is the closing session for Public Health Foundation Day, so you all are invited to join us and to celebrate the moment with ours. Thank you so much, everyone. Goodbye.
Thank you, Tatik Bhai. Thank you.
You are watching Raj TV. Jago